which category of people have that disease and are exposed to that risk. How can you understand that this category of people is more risky? How can you know about those? And another thing we are going to talk about is mode of transmission. How are they transmitted from one person to another? Such that we can know how to block its way, how to block how it is transmitted if we know the mode of transmission. Another thing we are going to talk about is the sign and symptom. Which sign shows that this person is likely to be affected by HIV? Apart from that one, leave alone that one, because sign and symptom may not confirm that this person is actually affected by HIV. What we are going to talk about next is how to test HIV. Thanks very much. You're most welcome. I'm Colby Rotumebiefe, aka Dr. Solomon from Kakoma St. John Medical Center. One. What is HIV and what is AIDS? AIDS is acquired immunodeficiency disease syndrome. So AIDS is a disease, a collection of symptom and sign that indicates that you have HIV virus in your body. HIV is a human immunodeficiency virus. It is just a microorganism. The other one is a group of sign and symptom. Okay? Sign and symptom. What you complain of and what the doctor finds from you. That is AIDS. Then the virus itself is HIV. Okay? Now, on epidemiology, when we talk about epidemiology, we are trying to talk about how do you know the different category of people which is likely to be having HIV. One is multiple partners. Those people with very many sexual partners. In marriage, you can find like very many wives. So those are likely to be having HIV. They have multiple sexual partners. They have sex with this one, they have sex with the other one, they have sex with very many people. Two, we have loss of spores. Those people whose wives or husband have been died of HIV. Those are one of some of the people who are likely to be having HIV. Another one is having sexually transmitted diseases regularly. Normally, for a disease like PID, for the women's section, that one we shall discuss about it when we have gone the other side of gynecology, when we are talking about STI, sexually transmitted disease, the UTI, blah 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 blah. We shall talk about it. But normally, when someone is having PID, when someone has been having sexual transmitted disease, STI several times, like the other thing which they call about gonorrhea, when that person has been having it every day, regularly, frequently, normally we were supposed to test about HIV. Those are one of the risk people who could be having HIV. Being a discordant couple, for example, when a man is HIV positive and a woman is not HIV positive, maybe a man is HIV negative but a woman is HIV positive, but they are staying together. Those people, they are likely to be having, they can, anytime they can contact HIV among themselves. And again, we shall talk about the uncircumcised people. Uncircumcised people, as you know very well, when they are having sex, the prepuce, the outer cover of uncircumcised person can hide HIV, and later on it enters into the urethra and go and multiply in the body. Another thing can be due to sexual intercourse. The prepuce can cause friction on the glans penis, the top of the penis, the head. So you may find the head is having injury, and that person can contract HIV, and the other, and very many others. So, mode of transmission. How do this HIV get transmitted from one person to another? Because when we know how they are transmitted, we can easily cap their strategy, and we can easily grab how their things happen and how they are transmitted from one person to another. We can block the strategy, because one of the major goals of the Minister of Health in Uganda is to cut off HIV within 50 years. And if we know how they are transmitted, we can easily block it with you and my effort as a Musau and as a patient. We can, as a client, we can know the strategy and we can block the strategy away. One of the mechanism of transmission is through sexual intercourse. Sexual intercourse, I meaning like having sex with someone who is affected. When you're affected, you're having sex with someone who is not affected. Still, you can transmit HIV among each other. Another one can be blood transfusion. The blood transfusion is also one of the risk factors. That one, the mode of transfusion, the mode of transmission from one person to another. That one I may not explain it because it is a self-explanatory. Another one is mother to child. For example, when you are giving birth and you are having, when you are carrying pregnancy, you are having HIV, you can easily transmit it if you don't get treatment. But these days, there is a prevention of mother to child transmission, PMTC. So, in that program, they make sure that all the mothers with the HIV, they go and deliver in they take the antenatal from a certain health facility, and they give birth. They give birth at a certain health facility, and there are some special care which are given to them, including the drug and the drug to the baby. At the end, you end up delivering a baby who is HIV free. Another one is